Good day, everyone, and welcome to our SMART webinar series. We have an amazing panel today of experts to answer your questions on ways to battle COVID-19. The webinar presentation will be 45 to 60 minutes, followed by a Q&A session. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You'll have the opportunity to submit text questions to our presenters by typing your questions into the questions pane of your control panel. You may send in your questions at any time during the presentation. We'll collect these and address them during the Q&A session at the end of today's presentation. All right, so I'm going to just go ahead and introduce our first presenter, Ann Ellett. Ann Ellett, nurse practitioner and certified gerontological nurse, is a dementia specialist, educator, writer, and speaker who continues to learn from persons living with dementia. For over 20 years, Ann has advocated for innovative and dignified care for people living with dementia through her association with Silverado Senior Living, and then as founder of Memory Care Support. So Ann, welcome.
Thank you, Andrea. Thank you all for joining this. These are perplexing times, and all of us who work in the senior living industry must be especially vigilant because our residents are at the highest risk if they get exposed. And we're on uncharted territory. This is all new ground for us. No one here has ever been through a pandemic. I know I've worked through fires and floods and hurricanes, but those are distinct events, whereas this COVID-19 pandemic is just a rapidly moving situation that affects the entire world. But we are at the crux of it in terms of caring for the most vulnerable people. So I ask us to be careful and thoughtful and reasonable in our actions and intent. Our residents and families are anxious, understandably so, but they will take their level of concern and anxiety from watching all of us. We are the leaders here. We are the ones that have the ability to protect our residents. And if we have a plan, if we are calm, the families will also recognize that. So we all want to be leaders and examples of how to conduct ourselves in this time of this pandemic infection. There are studies out that show that the senior living industry is not prepared for this, and there's a lot of chaos and disorganization going on. So first of all, let's keep our eye on the goal. Let's remember what our focus is. We have dozens, if not hundreds, of frail older adults that each of us have pledged to keep safe and provide a good quality of life for. We took that pledge when we accepted their money and allowed them to move into our senior living communities. And it's our mission that we keep these residents safe. It's the promise we made when we took these residents in. And older adults who are living with us, as you all know, working in the industry, the acuity of who's been moving into our communities has been increasing every year. So we know that most of the people who live with us have multiple chronic diseases, multiple chronic conditions on many medications. We know that the majority of them are also affected by cognitive changes. And so what's being recommended right now? Social distancing, which we're really not able to do in a communal setting like senior living. So we have to be creative. We have to look for best practices. And now's the time to demonstrate our commitment to these residents living in our communities, just the same as if we were faced with a hurricane bearing down on us or a flood. We would rise to the occasion to keep our residents safe. So we have to have a plan. And I'm not going to really go into the CDC information. It's excellent, it's accurate, it's important that we all reference it, but I'm assuming that all of us on this call have already looked to the CDC and are familiar with their information. If you haven't, here's a link that you can certainly look to. The other agency that it's important that we all link to is your local public health department, because they're going to be giving you local updates and recommendations. So your local public health department should be your new best friend. You should be reaching out to them. Again, another, this is from from CMS, and I know we're not licensed as nursing homes. We're licensed as assisted living usually, but CMS has put out best practices and recommendations, which are also great reference points. So here's another link that you can look up. But really, what can we do? And it comes down to communication is going to be key. First of all, our staff. Do they know what the plan is? Do they know that you have a plan, that you're organized? Because they're also going to be scared. They're going to be stressed. They're going to be sharing rumors and misinformation about what they've heard. They're worried about their families. So important that we're transparent and communicate with our staff. And we recommend daily short staff meetings at the beginning of every shift with the whole staff. You're getting the caregivers, the housekeepers, your culinary, your leaders, your nurses, everyone together for a brief team meeting. So you are timely hearing what their concerns and maybe any rumors or misinformation that they are asking about, and also so they get confidence from all of us. So communicate with your staff. Family members, how are you communicating with them? Do you have a plan? I'm encouraging that all executive directors send out an invitation to all family members, and because we don't want them to visit, but we understand how important it is they view their loved one. So they schedule and can make appointments for FaceTiming or Skyping or something like that with their loved one. So we're reaching out to them. We're not waiting for them to call us and say, I need to talk to my mom. We're reaching out initially. You can send daily emails with just a blurb of what the calendar is, what you're doing today to keep their loved one happy, to give them a good quality. And also share your plan. Share all the great things that you're doing to help keep their loved one safe. So they'll know that you have restrictions and screenings of visitors, and they know what your sanitizing protocols are. That's going to give them confidence in your leadership and abilities. I mentioned the local public health department. Reach out to them on a daily basis, see what their updates are. Your medical doctors and nurse practitioners, do they know you have a plan? Have you discussed with them their availability if you need to contact them regarding a resident who is ill or has had a fall? We want rapid response from them to avoid unnecessary trips out to the emergency rooms and hospitals, because if we can catch things early and avoid a hospitalization, then we have also helped not expose that resident to all the things that are going on in that hospital. So we want to avoid unnecessary hospitalizations and trips out. Of course, we have contacted family members. We're asking them not to take their loved ones out to medical appointments if they're not urgent. Because the less traffic in and out of your doors, the safer you will be. And vendors, do they know what your plan is? Are they delivering their goods out back and not tromping through your community? So these are things to think about and to put in place as part of your plan. And really, if you don't currently have the virus in your community, then the only protection we really have is not letting it in, because once it gets in, it will be extremely difficult to limit its spread because of the proximity of the residents and staff together. So we have to take this seriously on limiting. So you're restricting people into your building, and many states, for instance, yesterday, Texas just put out a new message from the governor that long-term care and assisted livings are not allowed to have unnecessary visitors. We have to be pretty hardcore about this. The communities that I'm working with, I have said that we don't even want, for instance, if you have residents that are receiving hospice services and they have someone who comes in 3 times a week to bathe that person, I'm saying we don't want that person anymore. We're going to do the baths. We don't want any extra person coming into our community. If the nurses and doctors need to come in, of course, but everyone who comes in, we screen them. Even the hospice nurse, even our medical director, even the person delivering something, they don't get past the front door unless they get screened for a fever. They sign that they have no symptoms of illness and that they have not traveled in the last 14 days. And then if they are well, then they can enter and go directly to the person they're going to see. There's no visiting with other people. They are going directly, doing what they came for, and walking back out. And of course, good infection control techniques, and we're going to hear more of that on this call from our other great speakers. But retrain every single person on hand washing, even though it's something that we know that we all have been trained on before. You retrain them and you have them demonstrate that they know how to do it. Washing surfaces many times a day, as much as possible, trying to distance residents from each other. So not crowding them in the dining room at once, not having large group activities. And then the fourth thing that I didn't put on there, but is equally important, is supplies. Be sure that you have adequate supplies. Do you have the gloves? Do you have the cleaning solutions, the disposable towels, the soaps? And people are going crazy about not being able to get hand sanitizer all the time. Remember, the first line is soap and water. So we don't always have to use hand sanitizer. Soap and water, washing your hands for 20 seconds minimum under running water with soap is actually the first indication from the CDC. Fear, false evidence appearing real. There is a lot of that going on. And that's why I say it's so important that you link up with reliable sources so you know that the information is accurate. We're not spreading rumors. We're not saying, well, I heard that we're going to have to live in the community for the next 14 days. I mean, don't spread things that aren't true. When you start hearing that, it's a sign that people are fearful and they're not thinking thoughtfully and intentionally. So we want to be prepared. We don't want chaos or disorganization, because it leads to non-productive actions. So we want to really have a handle on what's accurate and what's just a rumor. So briefly, I want to talk about best practices. And again, we don't want any surprises. We now have enough warning that this is very serious and it's going to get worse. So we have to think of the worst case scenario. We have to be prepared. We don't want to always just be reacting to the news. Oh, now we have to do this. Oh, now we have to do that. No, we know now. We have enough information. This is very serious and it's going to continue to develop. What is your plan? Put your plan out. Know your resources. How can they help? Many family members are asking, what can I do to help to support your community? So can they bring in supplies? What about local churches or schools or maybe dental offices that are closed, but they might have supplies that if you reached out to them or family members reached out to them, maybe they would share some of their supplies because they're not open anymore. Establish a phone tree to alert if there are needs. If families are reaching out and saying, what can we do to help? Say, how about establishing a phone tree so you don't have to call 10 people to let them know what you need, but you have one person who then will call 2 others, who then will call 2 others. So establish that kind of organization. Telemedicine. Have you, as I said, reached out to your healthcare providers? Can they do FaceTime? If you have a concern about a resident, or Skype, can you FaceTime them so you can get a rapid assessment and response from them? You don't have to wait till they're able to come in. So those are things you can set up ahead of time. And then I think we all need to talk with our healthcare providers and your public health department and say, okay, worst case scenario, what if we do get a positive case in our assisted living community? What's the plan then? So you have to have that conversation and not just react and be unprepared if it happens. The other thing we absolutely don't want to forget is how to support our staff, because remember, they're also scared. They also have families that they're concerned about. So how can we support them? So again, sharing your plan, helping to give them confidence that we're going to get through this, asking what they need, and think outside the box. Are they needing childcare now that schools are closed? Is there families that can come together and do childcare at their home if they don't have a daycare available? We found out that local YMCAs are really expanding and offering to do childcare in these times for healthcare workers. So reach out, find out what the resources are to see what you resources you can give to your staff. You want to recognize those staff who are going above and beyond. Instead of them staying home and sheltering in place with their family and trying to be safe, they are coming to work to help take care of our frail residents. So we want to support them. One community is having meals delivered to the houses of their caregivers. So, I mean, that's a great thing to do. Families may be willing to pitch into a fund to help with that also. So think outside the box, ask the staff what they need, let them talk about their stresses and concerns. You don't want them just keeping it inside, because believe me, they'll be talking to each other about it if they're not talking to you about it. It's all new ground. Most important, we want to keep calm. And some of us, when we get stressed, we knit socks. Others of us eat cupcakes. But most important, as leaders in the industry, we want to believe we're going to get through this. We will get through it. It's a learning experience, but if we're organized and have a plan, we will get through it. And we're going to come out stronger on the other side. So let's keep our focus on protecting the residents who are currently in our communities and have a plan to protect them. All right, thank you all.
Our next speaker is Michelle Currier. Michelle is responsible for the Unidyne Way culture, people, and engagement and recognition, and also learning and development and safety for the organization. With over 30+ years in the food and hospitality industry, she joined Unidyne in 2008 and has held many operational roles and joined the human resources team in 2014. Michelle brings a wealth of knowledge and deep expertise in food service operations, people management, team member engagement, customer service, hospitality, and overall safety programs to keep team members safe. Welcome, Michelle. Thank you so much for being here today.
Good afternoon. Thank you so much for having me on today's webinar. As you can see, we have a full agenda. Thank you to Anne for your great expertise being shared. We're going to go over today about reviewing our emergency preparedness when it comes to food preparation, our dining room service and in-room dining, as well as some alternative dining solutions that you can consider for your operations, as well as what do we do when our associates display symptoms. And we'll have time later during the presentation for questions. So first and foremost, as you all know, emergency preparedness really is the key. And following our CDC guidelines, as Anne had also shared, if you haven't already, you'll want to consider putting together an emergency plan with facility-specific information. This plan should be the first step to include emergency contact information, your procedures that your visitors, your guests, your team members will be following, such as food handling, storage of items, our menu, as well as staffing contingency plans, as our staffing numbers are known to fluctuate during times of crisis. In addition, we want to make sure water supplies, including the potable water for boilers, are also indicated. A lot of times we're not sure what to put on these plans, but there are some great FEMA guidelines from the federal government as well as others, and I believe we'll be sharing some tools later post-webinar. And we want to make sure the equipment will safely run and have a backup plan as needed. When we talk about food preparation, as Ann had also stated, practicing hand washing is key, assuring that our team members and our guests are assuring that they're following the proper protocol, and also following our respiratory hygiene, the proper way to cough in a tissue or using your elbow, but the most important, utilizing social distancing, which is so difficult in the environments that we work in. When we are considering our food preparation, I do want to share, there's been a lot of discussions over the last few days about how safe is our food. And per the FDA, they had made it very clear that there's no evidence that COVID-19 is transmitted by food handlers that handle the contact of food or food contact services or the packaging they're delivered in. However, it is extremely important for us to consider proper cleaning and sanitizing methods on specific areas and exclude the positive and exposed workers from handling food. We will talk a little bit more about the sanitizing methods, but knowing your environment and also how we can make sure we're utilizing it properly. But most important, we need to make sure that our teams are properly trained, that they understand proper HACCP protocols, as well as are they ServSafe certified to be able to help greatly mitigate risk and increase awareness to keep our guests safe. There's been a lot of discussions on using single-service foods, such as condiments, soups and cereals, and bottled beverages. These are a way that we're allowing for mitigating some of the risk during service. However, making sure you're aware that currently the demand is extremely high for any disposables, to make sure that you're preparing in advance for cutlery, napkin packs, as well as any closed food containers, so you have a backup plan. They made an announcement, I'm sure many of you are aware, that healthcare professionals and facilities will get first availability for a lot of the products that we need, but definitely looking at making sure your plan has enough stock in place for 14 days. When we talk about dining rooms, as Ann had stated, no communal dining service stations has really been a big play in the senior living industry. And when you look at what CMS and your state and federal recommendations are, you want to make sure that you're following those requirements and our team members are aware. So some of the ways that we can do that is making sure we're offering service at any stations, having proper table spacing, which is recommended for 8 feet. As well as minimizing the number that are in the same room for the personal space. Room service has been a great option instead of any of the stations that we serve, because no self-service options really should be available at this time. Those of you that may still be utilizing smaller dining venues with the proper table spacing, you'll want to consider moving to a single-use menu, or making sure that items that are handled by others are sanitized and properly air-dried after use. I know we don't really think about how we're utilizing our tablecloths and surfaces. However, we want to still maintain as much as we can for dignity of the residents and that we serve. We want to look at how often are we changing tablecloths. If we do not go to disposable, how are we handling post-service any of the tablecloths and napkins that might be utilized, in assuring that we're using a food-grade sanitizer for surfaces. There's been a lot of confusion on proper sanitizing. However, the FDA and CMS have put some guidelines out there to make sure that we're utilizing the proper materials. And one of the things you may have heard in the news quite a bit is how we're making sure that we're moving to prepackaged items, such as certain condiments, and making sure that we're not utilizing replacement beverages or refills, or people bringing in their own beverage cups to fill, and that we're using a new one every single time, that no outside dishes should be used. But really training is what the key is, and proper communication on all of our service changes and delivery. Because what we're doing today, as we get more and more information, that service model may change, and training and communication truly is the key to that portion. And when we think about in-room dining and think of different options, we really want to look at what can we do while we're following all the guidelines that we're working through. And I think when you're talking about offering room service, that this is a great meal period option for all of our guests by offering them in the community and placing foods outside of their rooms, or having an ability for them to pick up at a certain location, even if we're providing different timing for pickup. Assuring our teams are sanitizing their hands before they're going into rooms and then leaving rooms, and knowing how to utilize service with gloves properly to keep everyone safe. And more importantly, keeping our distance as we need to. And when we're working with anyone that might be quarantined or have a presumptive case, making sure nursing are those that are properly trained to serve those residents, while we also utilize the proper PPE or personal protective equipment as indicated for the type of service. Because it is such a challenging time, really looking at alternatives. I've seen some great opportunities where our teams are innovating while they're providing the best service outcomes that we can. Some of the examples are using a source of how to find the prepackaged foods that will meet their dietary needs, or prepackaged that limit the amount of space that is required in a resident's room. When we're looking at all of these different items, really being excited about an alternative, an innovation. And I saw one that was sent in that our teams are working with the facilities where they're using these great little baskets where they're delivering the meals with a note in it, providing a little bit of shine in each person's day. Because meals are still important. That's typically the time, 3 times a day, that all of us as humans want to have that interaction, and we're limiting that. So we want to make sure that meal service is a time that they also can have an opportunity to smile and know that someone cares for them, even if they're not able to have that contact. When we talk about team members displaying symptoms, I'm sure all of you have worked through the different areas that we're looking for with the respiratory symptoms of fever, cough, shortness of breath, or breathing difficulties, and advising team members not to come to work until they're either free of symptoms or at least 24 hours fever-free without any medication. However, really making sure you have standards put in place, that they're being cleared by a healthcare provider or someone who is in charge of that at your location. We, within Unidyne, utilize a decision tree for our managers to follow. We found that it's an easy way to say, if someone is doing this, this is how we will respond. And then depending on how that reaction is, we will respond either one way or another. It is something that can easily be put together, but provide our tools that we need for our people to be safe. When team members have family members or household members or someone they've come in close contact with or social contact, we want to make sure that if there's a probable virus symptom, that they're monitoring properly and also following that decision tree. Now, of course, these may differ as we look at our local, our state, and our federal guidelines, as many are implementing changes on a daily or multiple times during the day. So really staying aware and being in the know of all the regulations and guidelines as they're constantly changing. I know there's so much information out there that we're going through both on this webinar as well as other outlets. And I truly want to thank all of you for taking time today to join this webinar, because the more of us that are aware allow us to be safe and allow our communities to continue to grow and be strong for those that we serve. So thank you for the opportunity this afternoon.
Thank you so much, Michelle. That was a lot of great information, stuff that we probably don't think about. Okay, our next presenter, William Ross, is an executive with over 15 years experience in plant operations, hospitality, and business management, coupled with a degree in healthcare administration. William, as he likes to go by, has deep expertise in plant operations, regulatory compliance, housekeeping, laundry, and life fire safety. He oversees the National Core Works program and brings an unparalleled level of leadership and service excellence to our clients. Welcome, Tim.
Hi, Ann. Thank you very much. Can you hear me okay?
Sure can.
All right. Thank you, Michelle, and thank you for the opportunity to join this webinar. As she stated, I'm the Senior Director of Operations with CoreWorks. CoreWorks is Unidyne's response to the dynamic needs of the senior living community to provide high-level expertise in hospitality and regulatory compliance within housekeeping, laundry, and POM. We have a lot of stuff to cover today, so we'll go ahead and get started. So during our conversation this afternoon, we will be discussing the main objectives of a commitment to compliance, training and development, innovation, and the hospitality experience. These core objectives will support risk mitigation of infectious diseases, much like we're experiencing now with the current COVID-19 pandemic, and how the proper actionable precautions your communities can be better protected and prepared. With that being said, let's get started in our first topic, adherence to compliance. Standard precautions are based on the OSHA requirements, which are practices to prevent transmission of bloodborne pathogens. Standard precautions are intended to protect the frontline workers from all blood and body fluids, all of which can possibly contain bloodborne pathogens, including HIV and hepatitis. Standard precautions are based upon the caregiver's interaction with the resident. Standard precautions are based on the premise that all individuals are potentially infected with a bloodborne pathogen, and housekeeping workers must protect themselves from exposure to all blood and bodily fluids, including blood, perinatal fluid, pericardial fluid, and any items contaminated with these fluids. Each housekeeper must be able to evaluate the risk involved in the assigned tasks and establish standards for consistent use of barriers that will keep body fluids off clothing, skin, and mucous membranes off the wearer. These standards must be based upon the individual's skills and the interaction with body substances during the execution of assigned tasks. For example, a housekeeper assigned to clean a lobby or administrative office may typically find that no special precautions are required in most situations. However, the housekeeper that routinely cleans resident rooms and common areas must use standard precautions to prevent contact with blood and bodily fluids. The implementation of standard precautions requires that housekeeping management train the associates to evaluate the level of risk involved in a particular situation and react prudently. For example, a housekeeper assigned to clean the lobby may on occasion have to clean up blood from the floor. The housekeeper must be able to evaluate this as a high-risk situation and use precautions appropriate for the situation. Housekeeping management must also reevaluate waste handling when implementing standard precautions isolations. In addition to standard precautions, many communities also use transmission-based isolation precautions for patients with specific infectious diseases. This two-tiered system, recommended by the CDC, in standard precautions, all bodily fluids except sweat from all individuals, regardless of their diagnosis, are presumed infectious. Transmission-based precautions are used in addition to standard precautions for patients with known or suspected of being infected with epidemiological important organisms. Transmission-based precautions include contact, airborne, and droplet precautions. A combination of two categories of transmission-based precautions can be used. Contact and airborne precautions for a resident with chickenpox, for example. So to reinforce what we've discussed so far, standard precaution preparedness includes associates' health policy and procedures, hand hygiene policies and procedures, workplace illness prevention training, pandemic awareness, cleaning and sanitizing policies and policies and procedures, disinfection procedures and emergency supplies, social distancing, which we're all hearing lots about, and modification of our service style and client collaboration. Several weeks should be allowed for the extensive preparation required in effectively outlining the standard precautions of your community. Once these standards have been clearly outlined and communicated, a quality assurance program should be put into place to monitor and to ensure that the standard precautions are known and upheld. So with all that being said, there's a lot of training and development involved in this process. All housekeeping associates are to be completely trained in all procedures pertaining to the correct execution of their duties. This training will take place immediately upon assignment of the associate to the department and thorough ongoing in-service training programs. The associate's initial course of action should include, but not limited to, these basic steps: orientation to the physical layout of the community, orientation to the departmental and community policies, orientation to product usage, dilution ratios, and the equipment used by the housekeeping department. On-the-job training and classroom instruction in waste management policies and procedures, general training about disease, PPE, isolation precautions procedures, and required reporting procedures. The goal of training and development of team members is to properly support and prevent the spread of infections to residents, visitors, and staff. The spread of infections can be controlled by hand hygiene, standard precautions, isolation precautions, and cleaning and disinfection of the environment and resident care equipment. The methods and frequency of cleaning vary in different areas within a senior living community environment. The housekeeping department plays a major role in prevention and control of infections. Often a resident or guest may judge the professionalism and caliber of care he or she may receive by the quality that of the observed personnel, nurses, dietitians, and housekeepers. There is a psychological benefit to the resident and family when the environment is clean and orderly, when no offensive odors exist, and when adequate supplies are available. Clean surfaces, prompt disposable waste, and adequate supplies of soap and paper towels contribute substantially to a safe resident care. Good infection prevention and control requires that housekeepers be well-versed in isolation precautions and procedures. Many housekeepers are afraid to enter isolation precaution rooms and work around the residents within them. Education and practice will ease this fear. All team members should be trained in isolation precaution procedures during their initial training. Each team member's understanding and practice of isolation precautions, cleaning methods should also be tested. Hand hygiene, technique, use of protective gowns, masks, and gloves, adherence to procedures, and careful measurements of disinfectant dilutions are all emphasized during the initial and ongoing in-service training. In addition to training around infection prevention, associates are also trained to understand the different transmission precautions: contact, airborne, and droplet. Contact precautions are designed to prevent the spread of organisms through direct contact of a resident or contact with contaminated environment. Proper hand hygiene is critical to the prevent of the spread of these organisms. In addition, most healthcare environments require a gown and gloves to enter the room of a resident on contact precautions. The equipment and other items for residents on contact precautions should be discarded, disinfected, or bagged and labeled before being removed from the isolation precautions room. Airborne precautions are used to prevent transmission of infectious disease that are spread through the air. Staff must wear respiratory protection, the N95 respirator as an example, to enter these rooms. Associates cannot enter a room unless they have been trained to wear an N95 respirator. Fit testing is required prior to wearing an N95 respirator, and annual fit testing is required as well. Droplet precautions are designed to prevent infectious diseases spread through respiratory droplets in the air. These particles are heavy and can only travel 6 to 10 feet from the resident. Ultimately, the housekeeper is responsible for maintaining a clean, hygienic environment. Although the housekeeper is not directly responsible for patient care, each housekeeper should use the outlined guidelines when cleaning a room. Without question, one of the most troubling situations in senior living is the increased incidence of residents acquiring infections of the antibiotic-resistant type. Two of the most widely known are MRSA and VRE. It is critical to ensure the environment is clean to prevent the spread of these and other viruses through contact with contaminated environment. Fortunately, bacteria have not developed the resistance to disinfectants. The current disinfectants available are as effective in killing the antibiotic-resistant form of a strain as they are against the antibiotic-sensitive strain. Many companies that manufacture disinfectants have taken extra steps of having their products confirmed as active against resistant organisms. This step is voluntary and not required by the EPA. The most important action is thorough cleaning using a disinfectant that an EPA-approved cleaner disinfectant. Mechanical cleaning or agitation with water or detergent cleaners will remove most microbes. In fact, this is an essential step that must be performed properly before the application of a disinfectant solution. Most disinfectants are inactivated by dirt, large quantities of dust, or organic matter. The optimum conditions for a disinfectant to be effective are those listed on the product label. 9 basic principles should be followed to ensure maximum impact of the disinfectant. Measure the dilutions carefully. Using a clean, dry bucket. Avoid hard water or use a product labeled for use with hard water. Scrub dirt and debris away before applying the disinfectant. Use a clean cloth and change the cloth regularly. Change the solution as directed. Do not mix disinfectants with other solutions. And use a liberal amount of properly diluted product and keep the surface wet with disinfectant solution for the prescribed time on the product label. Management is responsible for providing effective disinfecting cleaning products and adequate supply. Disinfectants and germicides should be carefully selected and approved. Other products used in cleaning should be chemically compatible. Critical infection prevention and control supplies such as disinfectants for cleaning, alcohol-based hand sanitizers, and hand soap and paper towels for hand washing must always be in stock. A senior living environment demands more than just the removal of waste, soil, and dust. Disinfectant is the necessary process of destroying harmful microorganisms. Most organisms are swept away by the cloth or mop and deposited into the bucket where the solution kills them. Proper cleaning techniques should be followed to remove soil and organic matter in order for the disinfectant to be effective. Sinks, toilets, bathtubs, and showers should be scrupulously cleaned and disinfected because of their direct contact with residents. Equipment used in cleaning must be carefully cleaned and disinfected. Mops, rags, vacuums, and buckets can spread infectious agents. Mops, cloths, and germicidal solutions should be changed regularly to minimize the transmission of infections. Disinfection must be distinguished from sterilization. Sterilization destroys all microbes, including spores. Disinfection does not kill spores. In fact, within less than an hour after a surface is disinfected, the number of microbes may have returned to the original level. Periodic disinfection will keep microbes at an acceptable, safe level for residents and staff. Another tool in our toolbox for delivering safe resident services is an employing of a mobile work order management solution. This type of management tool helps prioritize, manage, and ensure completion and compliance-related tasks. This also allows us to schedule track areas that require more frequent cleaning and use real data to dictate any training or any opportunities. So, as we've heard everyone touch on it, and it's the hospitality experience and how to, to mitigate the fear and the rumors. So it's important to have, constant communication, as everyone has talked about so far. We've discussed a lot, and with many technical aspects outlined, which can be overwhelming, it is important to remember that as part of your organization's environmental service strategies, clear, concise, and complete policies and procedures will reduce stress and anxiety around the heightened times such as what we are currently facing. One area that remains consistent and top of mind in every interaction is our relationships with residents, staff, and family members. Often these interactions can help ease concern during difficult times. Therefore, exemplifying a hospitality-centric culture and customer service philosophy rooted in responsiveness and flexibility remains the cornerstone of all service offerings. This approach allows for associates to operate with a singular focus while leveraging extensive resources. With quality and compliance at the top of all of our minds, your on-site teams for your facility are designated to act as a network of resources, with each team member being responsible for specific areas that pertain to the delivery of services, training, compliance, and innovation, elevating housekeeping into a hospitality experience. Every moment that your resident spends in your environment contributes to their experience and overall satisfaction. Remember that image is everything, and maintaining a clean, safe, and positive space goes hand in hand with helping them feel relaxed. I just want to thank everyone again for allowing me the opportunity to speak with you today around the importance of your environmental services team. Again, a comprehensive standard precautions and associate policies and procedures will help mitigate risk. When those risks do develop and evolve, continuing monitoring, education, and reinforcement for best practices while effectively communicating with associates, caregivers, residents, and families will reduce concerns. If you feel that your community may lack some of the information that I've provided today, or you would like any additional resources in your planning and executing of any area of your environmental review, myself or my team would be happy to offer a free consultative services. You can find us out at coreworks1.com. Thank you.
Thank you, Tim. We really appreciate the information you brought us. So we have our last presenter, Deborah Howard, who is founder of Senior Living Smart. Deborah has more than 20 years of experience in sales and marketing, with the last 15 years dedicated to the senior living industry. Working through the ranks from community level sales all the way to national vice president with the 5th largest senior living company in the US, Deborah has gained a unique perspective and skill set. This experience has created a balance of hands-on coaching, modeling, and training skills, as well as strategic execution.
Everybody, just really wanting to talk about best practices around communication, and also just to have a couple follow-up questions with Anne as well, because I think these go hand in hand. You know, right now, families are really looking for us to be, have communication that's open, honest, and transparent. Obviously, everyone has a lot of concerns, and, they just are trying to answer questions, is my loved one safe? Are there enough supplies? Has everyone been trained? What's the visitation policy? Can we visit? And that changes almost daily. We found just yesterday, we had some folks in Texas who'd been really not limiting visitors to any great degree and still doing tours and move-ins. And, now that seems to be transitioning a bit. So, Anne, can we just have a conversation around what you're recommending? I think visitation is a huge thing.
Sure. I agree, Deb, it's super important. And I think we need to lean in to this situation and approach families and let them know how they can continue to access their loved one visually, as I said, or with daily emails. And also, it's so important that you talk about your great plan and organization to keep their loved one safe. Because if you don't outline that in really clear bullet points and look like you're organized and have a plan, they're going to assume the worst. So this isn't, while we can't be doing tours and move-ins, we can be bragging about how we're leaders in keeping their loved ones safe and everything we're doing about it. So transparency is very important, and also with staff, because staff is fearful also.
Yeah, so I mean, just to follow up on that point, you kind of mentioned what I think may be a hot button for a lot of folks. Can we, do tours and still safely take move-in? So I just want to kind of get your stance and also to reaffirm, like, you are literally taking the temperature of every employee and every resident every day. And then you really are looking at closing the perimeter of each community. So there's really only one entry point, and that entry point is really monitored. Can you let us know, like, how you're communicating about readmissions from hospitals or skilled nursing, probably hospitals more than that, and move-ins?
Sure. So, of course, we have the sign on the door that we are allowing no visitors. We've been doing this for over 2 weeks with the communities that I'm working with. Right inside the front door, it says if you're an essential healthcare worker, you can come in, but you will be screened. So even if our medical director walks in, even if a nurse walks in, they don't get beyond that initial front door where there is someone stationed that takes their temperature. They have to sign that they haven't traveled or have any respiratory symptoms. Just today, we're starting to issue disposable shoe booties that all staff and all visitors will be using, because there's information that healthcare workers are bringing it from one location to another on their shoes and their uniforms. So we are asking that we all use disposable booties when we're in there. We do not take tours and move-ins. I just think we have promised to keep our residents safe, and if we bring in outside people that we don't know who they've been in contact with in the last 14 days, we're putting ourselves and our residents at risk. So we have shut that down. And instead, as I mentioned, brag about the good quality of life that you're offering and brag about your safety measures, that people will want to move in with you after this.
Yeah, and a couple things I know that you had talked about yesterday were even having, if somebody is working at multiple locations, that when they come to your community, they have to change clothes or wear clean clothes in that had not been exposed in the other work location.
Correct. So very common for our staff to work at other locations. And while we can't forbid that or prevent that, if they come in, they take their shoes off and they have clean clothes that they've kept at the community, and they go into a private area and change into clean clothes, and they put on shoes that they've kept at the community. So our only protection, folks, is keeping this from getting inside our doors. Yeah. Once again, we cannot protect our residents and ourselves.
Yeah, and I know even deliveries, like food deliveries or supplies, are being left out back, and then the staff is going out with gloves and cleaning supplies and actually cleaning the boxes before they're being put inside. So these are kind of the things that we want to make sure to share with everybody, as best practices. And, I think as what Ann is saying is, we're going to have to make some difficult decisions. And we're going to have to communicate those. And the more proactively that we can communicate and reinforce, the better. So if we're going to, make those decisions around not taking move-ins or, maybe not having folks, maybe they're going to go home with their family after a hospitalization for a quarantine period before being readmitted. As each provider works through those decisions, we have to be really proactive in communicating that out, so that no one feels like they're uninformed. So thanks, Ann, for that. I think, as you look at communication channels, everyone just wants to stay informed. Here are some best practices that we've seen from from some of the folks that we work with. First of all, put a banner on your website, have a special COVID-19 message. We recommend creating actually a resource page that home banner is linked to, and there's going to be links out to all of the relevant information. If you have videos from a leader reassuring people, explaining the protocols and precautions, do a video. You can do Heart Legacy or One Day or one of those video type of handheld things. It doesn't have to be anything super professional. It's just that reassuring message. If you have downloadable guides or protocols or recommendations, any information you can share is going to be good. A lot of folks are using Facebook Live to actually host live streaming information sessions. We have a client that every day at 10 o'clock, every single executive director is on Facebook Live and interacting with families. And then once a week, the CEO is there or the head of nursing is there to give an update. If you use live chat on your website, which we highly recommend because people are coming with questions and concerns and they want to have someone to engage with. Right now your website's your new front door. People can't walk into your front door, so we've got to be able to engage people virtually. making sure that letters are going out, that email is going out, using marketing automation. If you can do a phone hotline or if you have a call center, utilizing those channels. If you want to automate like the schools do when school is closed for some reason and those automated messages go out by voice, text, and email, we have a Voice Friend is a great solution for that, and they can help set up those automated messaging channels, posting notices, and really having a prepared media statement just in case. Nobody wants to think that this is going to get into your building, but if it does, you don't want to be scrambling in crisis to draft a media statement. We can help with that. Senior Living Smart is here to be a resource. Anything else, Andrea?
Deb, I also would think it would be helpful to train the receptionists because they're
Yes.
the first line of questions from both walk-ins and from calls. So, training them what to say.
Yeah.
Who to give the call to, I think is really important because that could get you in a little trouble.
Yeah. So definitely draft however you want the people in the community to manage the questions and the responses. Better to give them talking points than to have them wing it. So
Yes.
So we anything else, Andrea?
Yeah. So we've got a few questions for the panel.
And Ann has to drop off, but we'll
Sure. Yep.
Yeah.
everybody.
I'll answer
Thank you, everyone.
the questions for you, Ann.
Yeah.
I love that.
Well, okay. Ann, do you have a quick second? Nope.
Sure.
Oh, because I think this is for you. What happens if a case is confirmed and the person is not in distress or not an emergency? Do you quarantine in the community?
Oh, absolutely. And just to get back to earlier about checking residents for symptoms, we check our residents twice a day for fevers and symptoms. So staff is checked at the beginning of every shift when they come in, including leadership, and residents are checked twice a day. At the first sign of a symptom, that person is quarantined. So you have rooms ready for this, or if they have a roommate, you're prepared to move that roommate out. If they have a private room, you're good to go. But yes, absolutely. You quarantine them. You check vitals every 2 hours. You call the healthcare provider immediately. Ask them to come over to assess the person. Remember, there are still the common cold and flus going around, and urine infections and other things that can cause fevers. So you monitor carefully, but they are immediately quarantined. Vital signs every 2 hours. Healthcare provider is called. If the fever spikes, they do need to be 911'd out.
Terrific. Thank you so much, Ann.
Okay.
Have a great rest.
Thank you.
And thank you. There's another question for either Tim or Michelle. How often should the community be sanitized? And I also I know there's a difference between sanitation and disinfection. So how often should those two things happen?
Thank you. This is Tim. I can answer that, Michelle. Right now, there isn't any current recommendation from CDC that's specific to doing this. We have implemented protocols at our communities to disinfect all high-touch surfaces every 2 hours between the hours of 6 a.m. and 8 p.m. I continue to monitor different resources and different channels for any best practices or recommendations, but so far, I haven't heard anything specific, so that's what we've implemented as a protocol until further notice.
Great, thank you. And we have another question, recommendations for residents with dementia who can't comprehend being quarantined. And I've worked with dementia care for 20 plus years in senior living, so I've been there through 9/11 and all those different times when residents didn't quite understand what was going on. So just a few recommendations I can think of is keep the news off. I'm not a big proponent of having the TV on except for a specific event, but I would make sure to keep the news off. Also, try to make their day as normal as possible. And I know they're quarantined, but a lot of communities have like enclosed courtyards so residents can still get some fresh air, even if it's still chilly out. Bundle them up, get them some fresh air. I found a situation where we used iPads with families. Families would send pictures to an address, and we bring them up on the iPad. And if the family was concerned, where's my daughter, where's my son? A lot of times just bringing up those pictures and showing them was very helpful. In the event that they can't do communal dining, at least try to make a little picnic in the room, or special delivery, and try to keep it as light and fun as possible. And I know hugging is bad, but just a reassuring maybe touch on the shoulder, and just a smile on your face, because that's how you react is how they're going to react. Unfortunately, there's no magic wand or easy answer, but hopefully some of those ideas will help you and your team keep everybody calm, and even though they can't, and they're not going to understand. So to tell them that they're in quarantine, they're not really going to understand that. So try to, keep it as light and possible. They're painting the sidewalks there. They're painting the outside of the community, so we have to stay in for a bit. But excellent question. Another question we have is, should community allow independent living residents to leave the community? That's an interesting question. I think what everybody is saying from the CDC and the recommendations from the task force is that as much as possible, unless it's important that the person leave, that they have to do something, it's recommended that everybody kind of stay put. And if it's something for grocery shopping, maybe that's something that the staff can do for them, or take the group at a designated time. But you really want to try to keep everybody staying put, because as Anne really emphasized, it's all about keeping the virus out. And one person comes out of the building, and now you're open to risk.
I think the image that I have in my mind is when that person comes back, that even that independent resident goes out, you're not on total lockdown. Whatever they've touched and whoever they've been in touch with comes back in the door with them. So they're not just carrying themselves back in the door, they're carrying every surface, every doorknob, every person that when they were outside the building, they're bringing all of that in.
Exactly. So that's it for questions. I want to thank everybody for hanging in with us. It ran over an hour, but there were some great questions, great information, and hopefully you'll leave the webinar with a solid kind of plan on going forward. I want to thank you for attending. Wish everyone stay safe and healthy. And we will be sending out a copy of the webinar along with a recording of the webinar as well. Thanks again. Thank you all to the panelists.